Welcome to my channel. For your health, don't forget to click to subscribe. Urinating after drinking water, he.s. not urinating for half a day. Is your kidney health hidden in your urination habits? Nepral voltages will help you uncover the urination code. When patients ask me, "Doctor, I urinate after drinking water. Is my kidney damaged?" This kind of scene is often encountered in the clinic. Xiao Li, a middle-aged woman, sits down with an anxious face, and the first sentence is, "Doctor, I have been urinating frequently recently. I have to go to the toilet after drinking a glass of water for half an hour. Is there something wrong with my kidneys?" And Lao Wang in the next clinic proudly boasted to me, "I can drive for 4 hours without drinking water or going to the toilet. They all say that my kidney function is good." As a nephrologist, I receive thousands of similar consultations every year. The truth is, the prevalence of chronic kidney disease in my country has reached 11.8, and about 120 million people suffer from kidney problems, but 90 of them do not know that they are ill. The kidneys are like the silent filters of the human body. Even if the function is damaged by more than 50, it may not send out obvious signals. Today, from the perspective of a clinician, I will start with the journey of a glass of water in the human body and analyze the deep connection between urination habits and kidney health. 1. The precision production line of the kidneys, filtering the whole body blood 20 times a day. The core function of the kidneys, the biochemical factory of the human body. Everyone has two fist-sized kidneys located on both sides of the lumbar spine. This pair of organs, which weigh less than 500 grams in total, has to complete 3 core tasks every day. Blood purification, filtering 150-180 liters of blood every day through about 1 million glomerular capillary clusters, equivalent to purifying the whole body blood 20 times, and finally concentrating it into 1-2 liters of urine to excrete metabolic waste, such as urea creatine. Electrolyte regulation, accurately maintain the balance of minerals, such as potassium, sodium, calcium, and phosphorus. For example, when you eat salty food, the kidneys will speed up the excretion of sodium. When you exercise and sweat, they will retain water to maintain a stable blood volume. Hormone secretion, secrete renin to regulate blood pressure, activate vitamin D to promote calcium absorption, and produce erythropoietin to prevent anemia. There was a patient who had severe anemia due to kidney function decline, and mistakenly thought it was iron deficiency. After iron supplementation treatment was ineffective, it was discovered that it was renal anemia. From drinking water to urination, 30 minutes of human water cycle. 1. Digestive tract absorption, after drinking 200 ml of water. The water is absorbed into the blood through the intestines and reaches the kidneys about 30 minutes later. To glomerular filtration, when blood flows through the glomerulus, water and small molecular waste are filtered into the renal capsule to form primary urine similar to the clear water version of blood, while blood cells and large molecular proteins are left behind. 3. Tubular reabsorption, when the original urine flows through the renal tubulus, 99 of the water, all glucose and amino acids are reabsorbed back into the blood. This step is like precision purification, and determines the final urine volume and composition. For bladder storage and urination, urine flows into the bladder through the ureter. When the storage volume reaches 200-300 ml, the bladder wall nerves send a signal to the brain and the urine is discharged from the body through the urethral sphincter. Normal urination takes about 21 seconds, the 21-second rule. If it exceeds 1 minute, be alert to urethral obstruction. 2. Differences in urination frequency, the combined effect of innate endowment and acquired habits. Bladder capacity, individual differences in the human body's reservoir. Normal range, the bladder capacity of adults is usually 300-500 ml, but individual differences can reach more than 1 times. People with a naturally small bladder capacity, such as 200 ml, are like small water cups. that are easy to fill with water and are more likely to trigger urination after drinking water. Clinical case: I have treated 2 volunteers. Mr. A has a maximum bladder capacity of 250 ml, and Mr. B has a maximum bladder capacity of 600 ml. With the same amount of water intake, Mr. A's urination interval is 40 minutes, and Mr. B can reach 90 minutes. This is a normal physiological difference and has nothing to do with kidney function. Urethral sphincter, the tightness of the valve. Muscle control. The sphincter is like a valve that controls the discharge of urine. Postpartum women or the elderly have a loose pelvic floor muscle, and the sealing of the valve decreases, which makes it easy to urinate frequently or even leak urine. There was a female patient who was 3 months postpartum and would leak urine when coughing. After pelvic floor muscle training, it was significantly improved. Dual effects of holding urine. Holding urine for a long time will cause the elastic fibers of the bladder wall to break, resulting in bladder weakness. At the same time, the contraction force of the sphincter is weakened after excessive stretching, and it will be impossible to hold urine. This is why some drivers frequently run to the toilet after holding urine for a long time. Drinking habits, the body's water memory. Dehydration stress response. When people who usually drink little water suddenly drink a lot of water, the kidneys will start the fast drainage mode, resulting in frequent urination. This is like a sudden rain on a dry land, and the water cannot be fully absorbed and utilized. Advantages of regular drinking. People who drink water regularly every day have a stable metabolic rhythm in the kidneys. One of my patients, Mr. Chen, used to wait until he was thirsty to drink water, but he urinated frequently every time he drank a lot of water. Later he changed to drinking 200 ml of water per hour, and the frequency of urination became regular. IV environment and sweating, dual channel competition for water. Seasonal differences. In summer, the human body evaporates about 800 ml of water through the skin every day, and the kidneys produce less urine, so there is less urine in summer. In winter, there is less sweating, and urine accounts for more than 80% of the water excreted, so there is frequent urination. A patient once went to the doctor for anxiety due to frequent urination in winter. After calculation, the daily urine volume was only 1500 ml, which is within the normal range. Exercise influence. During intense exercise, sympathetic nerve excitement causes renal vasoconstriction, and urine volume can be reduced by 50-70. The marathon runners I have coached almost never urinate during the competition. This is an adaptive adjustment of the body, not a kidney abnormality. 3. Normal urination standard. Don't be misled by the average value. Normal range, defined by medicine. Urinary frequency, for 6 times during the day for adults, 1 times at night. Note, the frequency here needs to be judged in combination with urine volume. If the urine volume is only 50 ml each time but urinates 10 times, it is frequent urination. If the urine volume is 300 ml each time and urinates 5 times, it is normal. Urine volume standard, 800 to 1000 ml per day is normal. Less than 400 ml is oliguria and need to be alert to pre-renal ischemia or acute kidney injury. More than 2500 ml is polyuria, need to check for diabetes or diabetes insipidus. Urinary characteristics of special populations. Pregnant women, the enlarged uterus in the second trimester compresses the bladder, and about 80% of pregnant women experience frequent urination, which recovers about 6 weeks after delivery. There was a patient who was 28 weeks pregnant and urinated 10 times during the day and 3 times at night. There was no abnormality in the examination, which is a normal physiological phenomenon. Elderly people, the bladder capacity of people over 60 years old is reduced by 20 on average, and the secretion of antidiuretic hormone at night is reduced, so the number of nocturia increases 1 to 2 times on average. If the nocturia exceeds 3 times and is accompanied by thirst and back pain, diabetes or kidney disease should be checked. IV7 Physiological reasons for frequent urination. Don't easily label it as kidney deficiency. I bladder sensitivity syndrome. Clinical manifestations: the bladder capacity is normal, but the nerve sensitivity is too high, and a small amount of urine can trigger the urge to urinate. I once treated an IT engineer who had the urge to urinate during meetings due to work pressure. The cystoscopic examination showed no abnormalities and was diagnosed as anxiety-related frequent urination. After psychological counseling and pelvic floor muscle training, it was relief. Pathogenesis: the cerebral cortex overreacts to bladder signals, similar to neurosis. Such patients are often accompanied by anxiety and need to be treated both physically and mentally. Eye effects of drugs and food. Diuretics: after taking the antihypertensive drug hydrocolloidosity or caffeinated beverages such as coffee and strong tea, urine volume can increase by 30-50. A patient once visited the doctor for unexplained frequent urination. After questioning the medical history, it was found that he drank 5 cups of strong coffee a day, and the symptoms disappeared after stopping drinking. Side effects of hypoglycemic drugs. Diabetic patients taking SGLT2 inhibitors such as DAP-AGLI-FL and may experience osmotic diuresis due to increased urinary sugar excretion, which is a normal effect of the drug. III Physiological changes during pregnancy. 3 stages of frequent urination during pregnancy. Early pregnancy 1-3 months. Hormonal changes lead to increased renal blood flow and increased urine volume. Mid-pregnancy for 6 months. The enlarged uterus compresses the bladder and the urine storage space is reduced. Late pregnancy 7-10 months. The fetal head enters the pelvis and further compresses the bladder, and frequent urination worsens. Coping strategies: drink small amounts of water frequently, avoid supine position, and do Kegel exercises to strengthen the pelvic floor muscles. IV Gender differences. Female urethra characteristics. The female urethra is about 4 cm long, about 20 cm for men, and is adjacent to the vagina and anus, making it prone to urinary tract infections. Data show that the probability of women suffering from cystitis in their lifetime is 50, which is 15 times that of men. Typical case: 25-year-old female, Xiao Wang went to the doctor for frequent urination, painful urination. Urinalysis showed 3 white blood cells and was diagnosed with acute cystitis. She recovered after 3 days of antibiotic treatment. Psychological interference. Sympathetic nerve excitement. Frequent urination before exams and interviews is caused by sympathetic nerve excitement, which speeds up blood flow to the kidneys and increases urine production. I once suggested to a college entrance examination candidate that he should relieve anxiety through the 478 breathing method. Inhale for 4 seconds, hold breath for 7 seconds, exhale for 8 seconds before the exam, and the frequent urination phenomenon was significantly improved. Conditioned reflex influence. Long-term urination at a fixed time, such as urinating before going to bed, may form habitual frequent urination, which belongs to nerve reflex regulation. Abnormal hormone secretion. Abnormal antidiuretic hormone ADH. Under normal circumstances, ADH secretion increases at night and reduces urine production. If secretion is insufficient, such as diabetes insipidus, the daily urine volume may exceed 5,000 ml. There was a patient who still felt thirsty after drinking 4,000 ml of water every day, and the urine-specific gravity was 1. 2 normal 1. 10 1. 25. He was diagnosed with central diabetes insipidus and needed lifelong ADH supplementation. Impact of diabetes. When blood sugar is greater than 10 mol, the amount of glucose in the urine increases, producing osmotic diuresis, which manifests as polydipsia and polyuria. One of my diabetic patients had a daily urine volume of 3,000 ml when blood sugar was not well controlled, and the urine volume returned to 1800 ml after blood sugar reached the standard. VII. Physiological degeneration with aging. Urinary characteristics of the elderly. The glomerular filtration rate of people over 60 years old decreases by 1 each year, and the renal tubular concentrating function decreases, which manifests as slightly more urination during the day 5-7 times. 1-2 times of urination at night, mostly 0 times when young. Key points for identification. If the elderly urinate more than 3 times at night and the urine line becomes thinner, prostate hyperplasia should be checked. If accompanied by foamy urine, renal function should be checked. 5 major hazards of holding urine. Don't let holding back destroy your kidneys. The 3 steps of bladder damage. 1. Reduced elasticity. The normal bladder wall is like a rubber band and can expand with the amount of urine. Long-term holding urine causes the bladder wall to overstretch and the elastic fibers to break, resulting in bladder weakness and a feeling of incomplete urination. I once treated a driver who held urine for 8 consecutive years while driving. Although his bladder capacity eventually increased to 800 ml, 200 ml of urine remained after urination. To risk of infection. If urine is held for more than 2 hours, the number of bacterial reproduction can increase 10 times, inducing cystitis and pyelonephritis. Data show that the incidence of urinary tract infection in people who hold urine for a long time is 3-5 times that of normal people. 3. Urine reflux. When holding urine, the pressure in the bladder increases, and urine may flow back to the kidneys, causing hydronephrosis. Severe hydronephrosis can compress the renal parenchyma and cause irreversible renal function damage. II. System chain reaction. Cardiovascular burden. When holding urine, abdominal pressure increases, blood pressure can instantly increase by 20-30 Hg, and induce cerebral hemorrhage in patients with hypertension. There was a 65-year-old hypertensive patient who held urine for 4 hours while playing mahjong. After getting up to urinate, he suddenly fainted. CT showed bleeding in the basal ganglia. Nerve damage. Overfilling of the bladder compresses the pelvic nerves, which may cause urinary incontinence or dysuria. One of my patients had urinary retention. After holding urine, had to keep a catheter for 1 week before neurological function gradually recovered. II. Warning of extreme cases. Bladder rupture. In 2023, our hospital admitted a truck driver who did not urinate for 10 consecutive hours. The intra-bladder pressure exceeded 400 cmH/O, causing the bladder wall to tear. Emergency surgery drained 1500 ml of urine, and the sequelae of frequent urination remained after bladder repair surgery. Acute renal failure. Long-term urine retention leads to bilateral or bilateral reflux. A patient was diagnosed with chronic renal failure 5 years later, and his glomerular filtration rate dropped to 30 ml in normal 90, so he had to start dialysis treatment. IV. Risks of urine retention in special populations. Patients with prostatic hyperplasia. Holding urine can easily induce acute urinary retention, which manifests as lower abdominal distension and pain, inability to urinate, and requires emergency catheter shunt. Pregnant women. Holding urine may stimulate uterine contraction and increase the risk of miscarriage. At the same time, urine reflux can easily cause pyelonephritis, endangering the safety of mother and baby. Patients with kidney stones. Holding urine can concentrate urine, and stones are more likely to rub against the urethra and cause severe pain, or block the ureter and cause renal colic. VI. Abnormal urination signals. The kidneys help code. Frequent urination with urinary pain, infection alarm. Typical manifestations: burning pain in the urethra during urination, turbid urine with odor, which may be cystitis or urethritis. Diagnosis and treatment process. Urinalysis. WBC 5HP high power field indicates infection. Urine bacterial culture. Identify pathogens. AD or Escherichia coli. Antibiotic treatment. Usually 3 days of treatment such as levofloxacins. Complicated infection requires 14 days. Incomplete urination, thinning urine stream. Prostate problem. Common in men. 50 of men over 50 years old have prostate hyperplasia, which manifests as waiting to urinate, thinning urine stream, and dripping after urination. Harm progression. The hyperplastic prostate compresses the urethra, which can lead to bladder diverticulum and hydronephrosis. I once treated a patient whose prostate hyperplasia was not treated in time, and eventually developed bilateral hydronephrosis, and renal function was impaired to the point of requiring surgical intervention. Treatment options. Drugs, receptor blockers, tamoxifen reductase inhibitors, finasteride. Surgery, transvertebral resection of the prostate TURP, suitable for those who are ineffective with drugs or have complications. Foamy urine edema, renal filtration disorder. Abnormal characteristics, fine urine foam that does not dissipate within 10 minutes, accompanied by eyelid or ankle edema, may be glomerulonephritis. Examination items. Urinalysis, protein positive. 24-hour urine protein quantitative, 0. 15G indicates abnormality. Renal function, increased serum creatinine and urea nitrogen, indicate renal damage. IV renal puncture biopsy, clarify the pathological types such as IgA nephropathy, membranous nephropathy. IV painless hematuria, a dangerous sign of tumor. Alert points, urine is meat washing water color or bloody, not accompanied by pain, may be bladder cancer or kidney cancer. Clinical data, 80 of bladder cancer patients have hematuria as the first symptom, of which 50 are painless hematuria. Diagnostic process. Urinary system B ultrasound, preliminary screening for lesions. Cystoscopy, the gold standard for diagnosing bladder cancer. Enhanced CT-MRI, evaluation of tumor staging and metastasis v polydipsia and polyuria weight loss, warning of metabolic diseases. Characteristics of diabetes, daily urine volume exceeds 3,000 ml, accompanied by thirst, hunger, weight loss, and fasting. Blood sugar and glycosylated hemoglobin need to be measured. Manifestations of diabetes insipidus, drinking a lot of water, more than 4,000 ml per day, low urine specific gravity 1. 5 caused by ADH deficiency or resistance. Differential diagnosis. Diabetes, blood sugar 7. 0 mol fasting or 11. 1 mol 2 hours after meal. Central diabetes insipidus, blood ADH level is reduced and exogenous supplementation is required. Nephrogebic diabetes insipidus, kidneys are insensitive to ADH and symptomatic treatment is required. The doctor's prescription for kidney protection, scientific management from drinking water to urination. The 3-3 system principle for drinking water. Total amount control, 1500 to 1000 ml per day, equivalent to 6-8 cups 250 ml per cup. Note the water volume. Here includes water containing foods such as soup, milk, and fruit, not just drinking water. Time distribution. 1 cup 200 ml in the morning, wake up the kidneys and dilute the blood. 1 cup 200 ml before going to bed, prevent blood viscosity at night. 1 cup 200 ml every hour, drink in several times, avoid drinking all at once. Water quality selection, warm water 40-45 is the best. Too cold stimulates the contraction of kidney blood vessels, and too hot damages the digestive tract mucosa. The 3-no principle for urination. Note for urination at night. Sit up slowly when getting up at night to avoid postural hypotension, especially for the elderly. There was a 70-year-old man who fainted after getting up to urinate urgently at night. He was diagnosed with orthostatic hypotension, leading to insufficient blood supply to the brain. It is recommended to place a urinal next to the bed at night to reduce the frequency of getting up. Urine observation, 5-check method. 1. Check the frequency, record the number of urinations for 3 consecutive days. If the number of urinations is greater than 7 times during the day or greater than 2 times at night, and the factor of drinking too much water is excluded, further examination is required. To check the color, dark yellow indicates dehydration, need to replenish 200-300 ml of water. The color of meat washing water indicates an emergency, see a doctor within 24 hours, and continuous foamy urine requires protein testing. 3. Check the smell. Raw an apple smell may indicate diabetic ketoacidosis, need to measure blood sugar. Ammonia smell indicates concentrated urine, need to increase water intake, and fishy smell alerts to infection. 4. Check the urine volume. If the urine volume is less than 400 ml or greater than 2500 ml for 2 consecutive days, seek medical attention in time to rule out pre-renal factors or endocrine diseases. 5. Check the accompanying symptoms. Frequent urination, low back pain, pyelonephritis, frequent urination, lower abdominal pain, cystitis, frequent urination, thinning urine stream, prostate problems. The comprehensive understanding of urination misunderstandings. The 10 most frequently asked questions by patients. Frequent urination means kidney deficiency. Do I need to take kidney tonifying medicine? Doctor's answer. In traditional Chinese medicine, kidney deficiency covers a variety of functional declines, while in modern medicine, frequent urination is more related to bladder function, infection, etc. Frequent urination in young people is mostly due to physiological factors such as small bladder capacity, psychological tension, which has nothing to do with kidney deficiency. Blindly tonifying the kidney may damage the kidney due to drug side effects. A 25-year-old patient took urinating Huang pills on his own for half a year, but his frequent urination did not improve. Instead, he was diagnosed with drug-induced liver damage. Can holding urine exercise kidney function and make the kidney stronger? Doctor's answer. Holding urine exercises bladder tolerance, not kidney function, and will increase the risk of kidney infection and urine reflux. Studies have shown that the probability of pyelonephritis in people who hold their urine for a long time is 3-5 times that of normal people, and in severe cases, it can lead to hydronephrosis and renal failure. Yellow urine indicates good detoxification, and the darker the color, the healthier it is. Doctor's answer. Yellow urine mainly reflects the degree of urine concentration and has nothing to do with detoxification. Continuous dark yellow indicates dehydration, and the concentration of waste in urine increases, which increases the risk of kidney stones and urinary tract infections. People who do not drink enough water every day have a 40 higher incidence of kidney stones than ordinary people. Old people's frequent nocturia is a natural aging, so don't worry about it. Doctor's answer. It is normal for people over 60 to urinate 1-2 times at night. If it exceeds 3 times and is accompanied by thirst and back pain, it may be kidney disease or diabetes. There was a 72-year-old man who urinated 4 times at night and lost weight. He mistakenly thought that old people are like this. 6 months later, he was diagnosed with type 2 diabetes and his blood sugar had reached 13.6 mol. Will drinking more water increase the burden on the kidneys, or will drinking less protect the kidneys? Doctor's answer. If you drink too little water for a long time, your urine will be highly concentrated and waste cannot be discharged, which will easily form stones and infections. Healthy people who drink 1500 to 1000 ml of water a day can reduce the risk of kidney stones by 50, which is reducing the burden rather than increasing the pressure on the kidneys. Is frequent urination in women a gynecological problem, so there is no need to see anaphlorigidals? Doctor's answer. Frequent urination in women may be caused by cystitis, urethritis belonging to urology, or pelvic floor muscle relaxation belonging to gynecology, or glomeruloneritis belonging to nephrology. There was a 30-year-old woman who had frequent urination in foamy urine. She mistakenly thought it was vaginitis. After 6 months of treatment, it was ineffective and was eventually diagnosed with IgA nephropathy. Children who wet the bed are naughty. Will it be fine when they grow up? Doctor's answer. It is normal for children under 5 years old to have nocturnal enuresis. If they have nocturnal enuresis more than 2 times a week after 5 years old, they need to be checked for urinary system malformations, occult spina bifida, or primary enuresis. Timely intervention, such as an enuresis alarm, desompressin, can reduce psychological impact. VII prostatic hyperplasia only affects urination, not the kidneys. Doctor's answer: severe prostatic hyperplasia can lead to urinary retention, bladder diverticulum, and even bilateral hydronephrosis, which damages kidney function. I once treated a patient whose prostatic hyperplasia was not treated in time and eventually developed uremia and required lifelong dialysis. IX foamy urine means proteinuria, which is definitely kidney disease. Doctor's answer: foamy urine may be proteinuria, or it may be caused by concentrated urine, increased urethral secretions, etc. A urine routine test is required for diagnosis. If the protein is negative, it may be a physiological factor, such as after strenuous exercise. If the protein is positive, further 24-hour urine protein quantification is required. X if the kidneys are not good, you can't exercise, and rest is the safest. Doctor's answer: moderate exercise such as brisk walking and swimming can reduce the risk of chronic kidney disease by 20 and promote renal blood flow. Kidney patients can do light exercise such as Wan-Jin, yoga under the guidance of a doctor, and avoid sitting for a long time. But they need to avoid high-intensity resistance training, such as lifting barbells, to prevent a sudden increase in blood pressure from damaging the kidneys. IX the truth behind the silent kidneys. Why is kidney disease often discovered in the late stage? I strong compensatory ability. The kidneys have the characteristics of half working and half spare. When the glomerular filtration rate drops below 50 of the normal level, the blood creatinine will increase. Clinically, about 30 of patients have lost more than 70 of their renal function when they first visit the doctor. And there are no obvious symptoms before that. Non-specific symptoms. Symptoms of early kidney disease are easily confused with other problems. Fatigue mistaken for work fatigue or anemia. Increased nocturia attributed to old age or prostate problems. Mild edema mistaken for drinking too much water before bed, or hypothyroidism. A 45-year-old patient had persistent fatigue for half a year. Treatment for anemia was ineffective. A kidney function test revealed that the blood creatinine had reached mol normal 104, and he was diagnosed with chronic renal failure stage 4. Limitations of routine physical examinations. Routine physical examinations usually only check urine routine, not kidney function blood creatinine, urea nitrogen. Urinalysis may be normal in early kidney disease, and microhemoglobin creatinine ratio (UACR) must be checked to be detected. Kidney B ultrasound is usually normal in early kidney disease, and can only detect kidney shrinkage in the late stage. IV screening recommendations for high-risk groups. The following groups need to have urine routine renal function (UACR) checked every 6 months. Diabetic patients disease course 5 years. Hypertensive patients blood pressure 140/90 Hg uncontrolled. People with a family history of kidney disease. People who take nephrotoxicous drugs such as non-steroidal antiphosphate drugs, certain Chinese medicines for a long time. People with recurrent urinary tract infections or urinary tract obstruction. Kidney protection in special scenarios, a complete guide from travel to medication. A guide to kidney protection during long-distance travel. Drinking strategy. Drink 100-200 ml of water every 2 hours. Avoid drinking less because of fear of finding a toilet. Urinate when stopping at a highway service area. Dietary precautions. Avoid excessive consumption of salty snacks, such as beef jerky. Potato chips. High sodium will increase the burden on the kidneys. You can bring your own low-salt nuts as snacks. Emergency treatment. If frequent urination, painful urination occurs, take a single dose of antibiotics, such as 0.5 g of levofloxacin and increase water intake. Key points of exercise and fitness to protect the kidneys. Pre-match preparation: drink 500 ml of water 2 hours before exercise. And drink 100–150 ml of water every 15–20 minutes during exercise to avoid dehydration. Risk of supplements: use kidney tonifying health products containing aristo-low-cic acid with caution. If some protein powders exceed the protein standard, they may increase the burden on the kidneys. Post-match recovery: if soy sauce-colored urine rhabdomylius occurs after strenuous exercise, drink sports drinks immediately and seek medical attention to avoid acute renal failure. Warning of nephrocalcicity in drug use. High-risk drugs: non-steroid ethanophylbenty drugs, ibuprofen, aspirin, long-term use. Certain antibiotics, gentamicin, amikants. Traditional Chinese medicine containing aristo-low-cic acid, Aristolophia lanceola, Aristolophia fenji. Chemotherapeutic drugs, cisplatin, methotrexate. Principles of medication: analgesics should not be taken more than 3 times a month. Traditional Chinese medicine should be diagnosed by a regular Chinese medicine practitioner to avoid self-administered folk prescriptions. When taking nephrotoxis drugs, monitor renal function regularly once every 1 to 2 weeks. IV kidney care during pregnancy. Prenatal checkup focus: urinalysis must be checked at every prenatal checkup. If protein is found, blood pressure and renal function should be further checked. Edema differentiation: mild lower limb edema during pregnancy is normal. If systemic edema, hypertension, proteinuria occurs, be alert to percalmoschiapa and seek medical attention immediately. Breastfeeding medication: when nephrotoxis drugs such as gentamicin are needed during breastfeeding, it is recommended to suspend breastfeeding to avoid the drug affecting the baby's kidneys through breast milk. Urine and systemic diseases. Doctors: liquid biopsy. Urine and liver disease. Indicator of jaundice. Hepatitis or cirrhosis: the urine is dark yellow bilirubin urea, and the foam is yellow after shaking, accompanied by fatigue and poor appetite. Obstructive jaundice: biliary stones or tumors block the bile duct, and the urine color is darker, similar to strong tea, accompanied by itchy skin and lighter stool color. Urine and gout. Excretion window of uric acid. Uric acid monitoring: gout patients need to check 24-hour urine uric acid regularly. If it is 800 mg, it indicates excessive uric acid production, and the treatment plan needs to be adjusted, such as adding allopurinol. Dietary influence: urine uric acid may temporarily increase after a high purine diet, such as hot pot, animal offal, so a vegetarian diet for 3 days is required before checking urine uric acid to avoid errors. Urine and drug monitoring. Antibiotics such as vancomycin need to monitor urine drug concentration to ensure that an effective bactericidate concentration is reached in the urine while avoiding nephrocalcicity. Chemotherapy drug toxicity. Chemotherapy drugs, such as methotrexate, are prone to crystallization in acidic urine, and urine alkalization, oral sodium bicarbonate, is required to prevent kidney damage. IV urine and genetic metabolic diseases. Phenylketonuria PKU, urine has a rat urine odor. Due to phenylalanine metabolism disorders, a lifelong low phenylalanine diet is required to avoid intellectual development disorders. Maple syrup urine disease, urine has a maple syrup odor. Due to abnormal branched-chain amino acid metabolism, special formula milk powder is required for treatment. 12 Doctors' final advice: 3-level prevention for kidney health. Primary prevention: prevention before illness. Basic measures: drink 1500 to 1000 ml of water daily, avoid high-salt diet 5g day, and control blood pressure, blood sugar and blood lipids within normal range. Exercise recommendations: 150 minutes of moderate intensity exercise per week, such as brisk walking and swimming, can reduce the risk of chronic kidney disease by 20. vaccination. Chronic kidney disease patients are recommended to receive pneumonia and influenza vaccines to reduce infection-induced kidney damage. Secondary prevention, early diagnosis and early treatment. Screening of high-risk groups. Patients with diabetes and hypertension should have urine routine UAC, or renal function, every 6 months. The general population should have annual physical examinations including urine routine. Early intervention, if microcurillinuncia is found. Timely use of RAS inhibitors, such as losartan, can delay the progression of kidney disease by 50. Tertiary prevention, delaying progression. Dietary treatment. Patients with chronic kidney disease adopt a low-protein diets RL. 6-8 gkg day. Add chitosidase to delay the decline of renal function. Complication management. Correct anemia using erythropoietin. Control calcium-phosphorus metabolism disorders taking phosphate binders. And prevent cardiovascular complications. End-stage preparation. Patients with uremia should learn about dialysis methods, hemodialysis versus peritoneal dialysis, or kidney transplantation in advance to improve their quality of life. As an nephrologist, I have seen too many silent kidneys fail unknowingly. There was a 35-year-old programmer who drank less than 500 ml of water every day for a month to catch up with the project. He held his urine to the limit before going to the toilet. After 3 months, he developed low back pain and hematuria. He was diagnosed with bilateral kidney stones with hydronephrosis, and his renal function had been damaged by 30. The kidneys are like life filters that work silently, processing hundreds of liters of blood every day, but rarely cry out in pain when damaged. From today on, please remember 3 key actions. Set a drinking water reminder on your phone and drink a glass of water every hour. Urinate immediately when you feel like urinating without delaying for more than 30 minutes. Spend 1 minute a month observing the color of urine. These small habits are all for the endurance of the kidneys. Finally, I would like to leave you a word. Although kidney disease is silent, it is not unpreventable. Pay attention to urination habits and have regular physical examinations so that this pair of life hubs can work for you healthily for a lifetime. If you have any questions, please leave a message for consultation. Let's work together to protect kidney health.